Hello, I'm Luisa Porritt, Deputy Leader of the Liberal Democrats in the European Parliament and an MEP for London. This time in our Brexit reality series, we're going to be looking at the issue of health and how that sector might be impacted by the consequences of a potential no-deal Brexit. This comes in a context whereby there have already been warnings that medicines come from elsewhere in the EU into the UK, 2/3 of them actually into this country. So any restrictions to that supply, potentially quite dangerous. We've heard from pharmacists and medical professionals that vaccines, insulin, painkillers, epilepsy drugs, antidepressants, these might all not be available should a no-deal Brexit go ahead. So I'm going to be talking to industry professionals and people whose lives will be affected by a no-deal Brexit should it go ahead, to see what they have to say. So Anthony, you've got a very personal story to tell about the effect that Brexit is already having on people's health. Tell me about what's happened to your wife.
Yeah, Brexit became extremely personal in mid-March of this year when we discovered that my wife had been diagnosed with a malignant lung cancer. We really just, it is like feeling the bottom has fallen out of your life. The words incurable, inoperable, but treatable. So we then got into the whole series of investigations and discussions around how treatable. And the oncologist at one of London's leading teaching hospitals looked around and clearly an expert in her field, and she said, okay, I've come up with something, but we do have a problem here, and that is that because of the departure of the European Medicines Agency from London to Amsterdam, and because there is considerable uncertainty over future regulatory divergence in pharmaceuticals between the UK and the EU, drug trials are now starting not to happen in the UK. This is a point that was made very clearly by the President of the Royal Society last month, pointing out that NHS patients are shortly going to be deprived access to major drug trials. So our oncologist contacted the company running this particular global drug trial. It's taking place across the United States, and we were contacted. We now have to travel to the Netherlands every 28 days for my wife to get access to a phase 2 drug trial. This is an unlicensed agent, in order to try and save her life. As you can imagine, this is deeply, deeply distressing. It will be difficult at the best of times. The complications around having to travel to another country, silly things like going through airports. We now have to have a complete list of all the drugs when you leave or enter a country, you go through security. In a post-Brexit situation, this is an unlicensed agent. It is not on the British Pharmacological Register. I am trying to get a minister to accept responsibility for this and to issue a letter stating that, notwithstanding, this is a permitted import into the UK. Because it really, in a post-Brexit situation, who knows what the legal situation is going to be.
Yeah. And have you tried contacting the relevant minister already, and what sort of response have you had from the government, if so?
So far, I have had the standard fob-off response from the Medicines and Healthcare Regulatory Agency, which is, they're there, it'll all be all right on the night. So I'm now elevating this through my local MP, our local MP, to see what, well, frankly, to try and chisel a response, but also so that they start understanding just what they have created. The point is that this is not a forecast, this is not a prediction, it's happening now, it's already a reality.
Yes.
It's happening to us, and it is very likely going to be happening to however many people in the future.
As you said, this is the reality of the situation, and you and your wife are already in such a difficult position having to deal with this illness.
Yeah.
What kind of additional burden is that for you to have to also travel on top of it while she's very unwell?
Data, even within the EU, whilst we're still in the EU, transfer of data. We cannot get access to medical records because you have to be a Dutch taxpayer. This is an aspect of it. So we have to get everything hard copy. That comes in Dutch. I'm having to become a lot more adept at Dutch. Not just ordinary Dutch, but specialist, professional, medical Dutch terminology. So there's that. There are the issues around, as I've already explained, importation and exportation of drugs in and out of the country. Bupa, my wife's firm's medical insurance is provided through Bupa, will not cover a drug trial that's taking place outside of the UK.
Really? So if the trial was available here still, then she would have been covered?
Correct. Yeah.
And then you've got the cost of the travel on top of that?
The my wife's costs are covered. Mine are not. So we're already.
Of course, you have to be there to support
every
her.
28 days. So this is months in. I mean, we are thousands. I'm not going to be having her going unaccompanied.
Of course.
On to the Netherlands. This is a shared experience, and she cannot be expected to do this on her own.
Yeah.
We are largely on our own in this because it just feels like we have a government that is prepared to throw people to the dogs.
Yeah,
in the
just for an
pursuit
ideological
of a narrow,
Brexit.
partisan, sectarian ideology.
Yes. Well, Anthony, thank you so much for sharing your story. It's been a very difficult thing to talk about, but as you said, this is the reality of how people's lives are being impacted already.
Yeah.
And in the event of no deal, it could get much worse for a lot of people.
I pray that the worst doesn't come. But the supreme irony is that a lot of those people who thought that they were voting for taking back control and, I don't know, liberation from what I don't know, but this could be a reality that will come back and bite them very, very hard. I just hope it doesn't happen.
Yes, well, we'll keep doing all we can to try and stop that, and hopefully opposition parties will be able to continue working together effectively to prevent more situations like yours from happening.
Yeah, I hope. I pray. Thank you.
Thank you. So Sadia, you're a doctor working across hospitals in London. Have you seen any impact already to date as a result of the uncertainty around Brexit?
Yeah, I think it's really affecting the morale of a lot of the junior members of staff. We're already under a lot of pressure, and a lot of posts are filled with EU nationals. It is quite a significant number. So if that isn't available anymore to fill the posts necessary, A lot of us are thinking, where are the doctors going to come from? Because the government isn't really investing in training medical professionals, but at the same time, that door will close to, get EU citizens to be able to fill those posts. So there will be added pressure on frontline staff.
And you've said before that because the funding pressures on the NHS, you're already under a lot of strain in your day-to-day work and having to take on more.
Yeah.
What do you think will happen in the event of a no-deal Brexit, and especially if we then see it much more difficult for EU nationals to carry on working for our NHS?
I think that the staff that already exist working in the NHS, they will find that their workload will increase quite significantly, even though it might not already be manageable. And I think that it is taking advantage of the goodwill of a lot of the doctors and nurses that work within the NHS to expect them to take that on without having sort of hands in place to help the NHS really.
So one of the other things that we've been hearing about a lot, apart from the staff shortages and that pressure on the NHS in the event of any form of Brexit, is that there might be a restriction on medical supplies, particularly if there's no deal. Is that something that you're concerned about and that your colleagues are talking about as well?
Yeah, I think that's certainly something to be concerned about. I think I'm particularly going to emphasise the point of general practice surgeries because the pharmacists there do a very good job in making sure that patients are getting their medication on time. I wonder what will happen when there's added sort of loopholes to be able to get medication across for patients and whether there will be even longer wait times to be able to do that really.
So lots of aspects to worry about in terms of your capacity to deliver patient care.
Yeah.
Well, I very much hope that this scenario won't play out because you're already in such a difficult position, and thank you for going and doing the work that you do every day. So you've heard it. This is not Project Fear, it's the Brexit reality. I've spoken to a doctor who says that already the NHS is suffering from staff shortages because EU citizens, particularly in London, are working for our hospitals, and this could all get worse in the event of a no-deal Brexit. The uncertainty has been weighing on the staff here and their morale, and given the funding pressures that the NHS is facing because of the cuts to central government funding, this is only making the whole environment much more difficult for people working in hospitals. And on top of that, I've spoken to Anthony today, who has told us the really heartbreaking story of his wife who's suffering from stage 4 lung cancer and now is having to travel to the Netherlands just to access the drug trials that she needs to get treatment. And lots of other people could be facing these sorts of risks should a no-deal Brexit go ahead. It's absolutely essential that we stop Brexit because lives are at risk.